Hi, my name is Kristy Wolfe, and I am a medical parent and a volunteer who has been involved with research in the medical field. I'm also a storytelling photographer who tells stories for special needs, medical, and palliative families. I was there too as a conversation that I'm having with other photographers, with medical families, as well as sometimes healthcare professionals. Today's episode, we are talking with these three lovely people about how we can increase awareness for the how and why families should get involved with research. So I'm going to let each person introduce themselves. Chelsea, why don't you start?
Awesome, thanks. My name's Chelsea. I wear a few different hats. So I am currently a student. I'm completing my PhD in clinical child psychology. I'm also a researcher and a provisional psychologist. Schooling has kind of been a main part of my life for the last 2 years. And one of the nice things about that is I've gotten to explore different parts of Canada and live in about 4 different cities in the last few years, which has been a really cool side of being a student.
Thank you. Joanne, tell us about you.
Yeah, so hi everyone. I'm Joanne, and I have been a pediatric nurse for the last 8 years. 8 years, and in over the last 8 years, I've worked in different clinical settings, namely like the children ICU, and right now I'm working in a pediatric palliative care hospice. So, like Chelsea, I am also a student researcher completing my doctoral studies, and yeah, I've been also a student for most part of my life, and yeah, I get to practice alongside it as well while studying. So
Thanks,
yeah.
Joanne. All right, Lawrence, tell us about you.
Hi everyone, my name is Lawrence Ng and I am a research coordinator supporting clinical scientists in the area of rheumatic disease, including childhood lupus as well as juvenile arthritis. Those are the rare diseases that we are doing actively a lot of research for. And then I'm also a father of a developmental delayed child, now teens. And I like always to advocate for children with chronic rheumatic conditions.
Perfect. So you've got quite the squad talking about family engagement in research today. And Joanne is going to explain what is family engagement in research.
Yeah, so family engagement research covers the entire spectrum from patients to caregivers. Really, they are acting as consultants, advisors, collaborators, or project leaders in the research process. So FER is mainly to encourage research partnerships with those most affected by health research as key stakeholders.
Thank you. So I got involved with family engagement and research. I didn't even know I was getting involved, but I had a son. He was 8 weeks early. He had congenital heart issues and congenital spine issues. And after we were out of the neonatal intensive care unit, somebody came up to me and said, you should get involved with the NICU family advisory care team. They need to hear parent voices. They need to hear your story. And so that's really where I started. And it has gone through a number of different things. And I got to the point where I was doing peer mentoring and able to talk to people about what it's like to be a family in hospital and relate to their experience about it. How did each of you get involved in this research? So Lawrence, why don't you take this one away first?
So I get involved in clinical research from simply speaking, I was a lab technician before, and then from the bench side, I don't see much of what's happening in the clinic. However, my career path got changed 180 when my supervisors start getting involved in a lot of clinical research, which sent me to the clinic and start to approach patients and families for research studies. So there I learned a lot of skills and able to explore the whole different dimensions of how research impact patient and family lives. But I also learned a lot of different skill set in terms of how to be involved in research as well as advocacy around patients with chronic conditions.
And can you speak before we go on? Can you just talk about whether your son also had any pull to you for research or if that happened later?
I think mainly what I found the most most important thing that I learned is from the journey where being a parent of special needs children, you always find there's some gap of service delivery as well as how to measure it. For example, for developmental delay, a lot of measures that we encounter in the past when he did have the consultations that the tools may not be fit for his age or his abilities. So that's why I find there's always a gap in able to make things more impactful by generating more evidence-based research tools and turn it into clinical utilizations.
Thank you. Chelsea, what would you say?
Well, kind of similar to Lawrence in that there's been a lot of evolution in sort of my my time in the research world. So I started as a master's student. I had to create a master's research project as part of my degree. And so I kind of stayed within this very academic research world for both my master's and my PhD research. But I was very fortunate to be involved as a research assistant, so kind of taking on other roles in other people's research projects that included a lot more, I guess, patient involvement and multi-stakeholder perspective. So I was involved in a great project that had a lot of parent involvement, child involvement, service care providers, teachers, and kind of weaving together all these different pieces within the research design and carrying out the research project. So as I've kind of gone through my schooling, I'm now entering the sort of clinical research world and seeing that there's a really big need to include parent perspectives in research, especially within children's mental health research, which is where I kind of tend to focus on. So that was, yeah, kind of an evolution, but I'm so happy to kind of end up in this sphere of the research world.
Nice, thanks, Chelsea. And Joanne, how about you? How did you get involved with research?
Yeah, I guess also I have to say Chelsea and we share quite a similar trajectory. But for me, I guess as a clinical nurse, I find myself previously advocating, or rather still advocating, for better quality of care for my patients and and the families that I care for. But more so along when I move along my career, I found myself like asking, is what I advocate the same as what the patients or the families want? So am I doing a good job in representing their voices, and are they kind of getting the support that they actually need? So these were kind of the prompting questions that got me more involved in research itself. But now as I move along my PhD work, I realized that having actually family being involved in research would actually be more meaningful, because then they're actually giving us their voice. They're telling us what exactly they want and what exactly they're hoping for, and using our expertise, we're collaborating, hoping to collaborate with them to get to a point where we're providing support, help, and research information to families that find these information meaningful.
Yeah.
So
awesome. Thank you. Now, we've all been in this journey for at least a while. It sounds like some researchers have been here quite a while. I'm about 8 years in with our family. What do you wish families knew? What do you wish new families knew about family engagement and research? What do you wish new researchers knew about it? Chelsea, I'm going to start with you this time.
Sure. So I think, probably the biggest piece that I wish I knew, or advice that I would give to other researchers, is just how much their different perspectives enrich the project. I think being involved in a project where there was a lot of different stakeholder involvement, we wove together a lot of different voices. I think the end product was so much richer and so much more detailed and meaningful. So yeah, I think it's so important.
Thank you. Joanne, how about you? What advice would you give?
I think from a researcher's perspective, I wish I knew that there was actually support out there that, help researchers to uh, uh, get in touch early with this whole idea about family engagement research, so that even as a student, making like that point of that's a good starting point in developing like our research career. Uh, yeah, but sometimes this kind of sources of information or like really finding out support can be a bit tricky at the
Yeah.
same time.
And I like over the 8 years that we've been involved, I've noticed a difference in how much people are talking about family engagement and research. It is much stronger now than even 8 years ago. Lawrence, what would you give as advice? Because you've been in this realm for a while now.
Yes, I am, and I see different change and evolving themes around family engagement in research. But I personally think that from observations that especially in my discipline and area of research, that a lot of families are encountering uncertainties and late in diagnosis, for example, a lot of frustrations, and they couldn't find out how they have lack of control of the conditions as well as life, let alone medication side effects and what else. So I find that this focus of empowering them with family engagement and research is really important to give them a tool to be able to say yes to things, to be able to take control to things by actively engaging in different process of research, raising the voice, as well as telling researchers and clinicians what is important to their life and how do they be able to achieve their goals and targets in terms of making a change in their child's outcomes.
Yeah. And I really realized how important the parent voice is, like being involved in one of the things that I was involved with early on was called NICU Baby's Journey. And they were trying to go from pre and antenatally into like right into care for kids after they'd spent time in the NICU. And they had stakeholders from your family physician all the way through to watching like the clinics that watch after baby leaves the NICU. And that journey, there were so many people involved and we had mediators and I was the only parent at the table. And it was scary to have all the neonatologists and the nurses and the nurse practitioners and everybody was there. But the number of times that staff said to me, we are so grateful that you're here because we need to hear that parent voice. And the fact that I was the only parent in this huge, long, basically research, like we were doing research within the hospital, but it made me realize how important it is to have a family voice there. And I think that there honestly needs to be more than one family voice because every family is having different experiences. There's service gaps in different area, depending on what your diagnosis is. And what I know now compared to what I knew 8 years ago is totally different. So we're coming at it with different viewpoints too. So that's kind of why I've stayed involved with research. Honestly, that baby's journey experience taught me how important my voice was, and it got me involved with other things as we went. Chelsea, how come you're still involved?
Yeah, so I find that I'm hearing from sort of multiple areas in my life how important it is to include that parent voice. So in the sort of preliminary research findings that I have for my dissertation study with parents, I've had a lot of feedback from parents saying like, I've never been asked to provide my perspective or provide any input before. And then also just recognizing that there's this gap in research within the clinical research realm where, a lot of parents aren't being involved in research projects as a collaborator, as a partner. So I think sort of merging those two pieces for me highlight the importance of why it's important to stay here and to keep working on this.
Nice. How about you, Lawrence?
To stay in, get involved in research and stay in research, I think it's partly because over the years, I was able to utilize my skill set and assist in the disease discipline that has my background has related to, because family with rheumatic conditions, and that's really important to realize that there is always some new findings that we can explore, and then things that we can do instead of staying in the dark, like most of the parents and patients, because there is really important in terms of having hope for something that has like a chronic conditions. So being able to be involved in this process is really important. But then the thing is that because I'm having this career, I think it's really important to also to partnership with patient and family to be able to understand what different journey means to them in terms of diving into all the important issues, as well as try to find what will be ultimately the most impactful for their lives. I think that's it's important. But with that, a lot of researchers, especially I can see new research coming along, they may not be aware of such a process and such opportunity involved. So I guess that's why we as researcher, as well as long-term partners with patient and family, I think the education piece that we can bring through with experience, that's really important to be able to give them that skill set.
Mm-hmm. And Joanne, what would you say? How come you're still involved with research?
I think it's just mainly my interest really in working with families and patients to help them achieve kind of the care that or support that they want. So like part of my plan is to future plan and is to also develop like kind of supportive program for children receiving palliative care services within the hospice. And I think at this point, having like really utilizing family engagement research is really like going to make the support program more effective, more efficient in this where parents involvement and like siblings or like families involvement can kind of create a program that is designed specifically for them and tailored to kind of their needs. And so I think basically it's just my interest in really wanting to create programs and improving kind of like the care that they receive, specific like just to meet their needs.
Well, I'm really glad you brought up siblings too, because I think we focus on the patient and we talk about the caregivers and the parents, but there's such a big piece around the siblings that is addressed in some cases, is starting to be addressed more, but I think that is definitely something that parents are thinking about. What about the other members of our family and how do we support them as well? Our last question that we're going to talk about is how can families get involved in research? So the point that I was going to make, there's a lot of ways and each of us will talk about something different, but there are Facebook groups now. There's one particularly called Parents Partnering Research Facebook group, and we will put that in the notes with a link, because there are groups that are now connecting families to researchers or to research opportunities, because over the course of COVID, lots more has gone online, which has made it accessible to many more families. And that barrier of childcare is taken out, and the barrier of travel and where you live in comparison to where a study is going on has been removed. So there's just more opportunities with social media to do some pairing. Chelsea, why don't you tell us about another option?
Sure. So I can speak to CAMH, the Center for Addiction and Mental Health in Toronto. So I work as a psychology resident there. And there is a sort of up and coming patient and family engagement structure. And so currently the point of contact for families looking to get involved in research would be Connie Putterman. So I can include some of the contact information that she provided. As well as just within Alberta, there is a patient-oriented research organization, and I know that they have a family panel as well, where parents can join research teams, discuss healthcare system experiences, and provide input on research projects.
And I should mention that our panel is Ontario and Alberta based. So those are the ones you're going to hear the most about, but there are other things happening across the country as well that we'll touch on a little bit more. But Lawrence, what were you going to say? Because yours is kind of more applicable to anywhere you are in Canada.
Yeah, I think I'm involved in the Research Family Advisory Committees, which this body is really bring in parents' voices into advising in research in a mutually respectful manner in terms of the decision-making process regarding to implementation of research, clinical research. And with that, our objective is trying to ensure that research is as sensitive and as meaningful as possible to the family and the patient. We met monthly to review some of the research protocols or even some of the researchers bring in the research questions for us to give advice on. We have a 50% family members component. So a lot of the onboarding family advisors are actually part of the SickKids Family Advisory Councils. And they are all onboarded and have this strong will of wanting to make an impact and change the landscape of how research can be done and to be able to develop some of the different ways and education materials in terms of guiding families who would like to do more about involvement in research in different process.
And that's one, I'm just going to jump in, Lawrence, because that's one that like I got started with, joining the Family Advisory Council and just being on the newsletter list so you'd get information. Can you help with this? Can you help with that? And you don't have to say yes all the time. You can do the things that apply to you, but that is a really good starting point for any family to just look into your hospital's Family Advisory Council, because most children's hospital are doing something like this. Sorry, Lawrence, back to you.
No problem. I do realize that there are a lot of different institutions also are building or already built some of the structures and framework to be empowering a family to do that same thing. I think it's really important for the voice to get out there to be able to let people know about that this exists and be able to take the first steps. That's really important.
Nice, thank you. And Joanne, what would you say? How can people get involved?
Yeah, so I think from my experience as a clinical nurse and being as a student, being part of the pediatric advanced care team at SickKids as a student, I think those going through getting involved in research through one of those specialty teams in children's hospitals or like institutions, like they are definitely a good way, because I think through the specialty teams, they're always looking for research. They're always designing, coming up with research projects that, you know, are targeted, like aimed to help work around the challenges, barriers of what the families are experiencing. So that's definitely a good point of entry for a lot of families who are interested in participating, and for researchers to kind of connect with families as well.
And I think that fits with like the diagnosis piece of it. Like we've found out about most of the very specific research we've been involved with has been through cardiology specifically, but anybody with any kind of diagnosis that's seeing some kind of clinic will have more information about studies related to that specific area. And so some families are dealing with multiple clinics and have a variety of projects they could choose from. And talking to your care team and just seeing if there's anything or letting them know that you're interested in supporting research is a really good first step. You guys, thank you. I think we've covered how and why families should get involved with research. So here's hoping we get lots more families involved.